Good afternoon, everyone. It's Michelle Hill with Southern Inspirations in the Maumelle Area Chamber of Commerce. I hope you're having a wonderful Tuesday afternoon. I am thrilled to have another guest to talk about a local business and ways that she and her team are giving back, particularly in the healthcare industry, and ways that she is affecting us all. Welcome, Shirley.
Good afternoon.
It's good to have you. I thank you so much for being a part of this show.
Thank you for having me.
You are welcome. Put my glasses on here so I can see a little bit better. For everyone that's watching, please meet Shirley Walker. She is the founder, president, CEO of Team CPR. And today we are going to have quite a dynamic discussion, and one that I've been excited about for several days since we agreed to do this. We're going to talk about CPR. Shirley is going to let you know what that is and what she does and why we chose the title Behind the Clinic Visit. And then we have some other fun discussion top points about entrepreneurship and ways to get back, and a way that she has tied in with something education specific. So lots of good stuff to get to. Shirley, take a moment, if you will, and tell folks a little bit about yourself. I know that you have over 30 years of experience in healthcare in all sorts of ways, from provider relations to contracting and etc. You've been married for 30 years. You've got a couple of boys and a couple of dogs, and you travel and take pictures. So just kind of tell us, let us hear a little bit more from you.
Sure. Yeah, the boys and the dogs, it's funny, I'm the only female in the house. It doesn't matter, kids, dogs, whatever. I'm the only female in the house. So that's always an interesting dynamic. I founded CPR in February of 2010 after having worked for a frighteningly long period of time between a couple of different health carriers. And I had most recently been the provider relations manager for one of the larger health plans in the state, QualChoice, and
Okay.
had worked with a lot of different clinics and had kind of seen directly what they were struggling with. Clinic managers either have a lot of knowledge and expertise and just no time to execute, or they really don't know where to go with things. So when I started the company, it was really out of a desire to help those people be able to navigate the healthcare system, make the connection between provider and patient and carrier, navigate those contracting issues that they run into, help them get their claims paid better. And as the company developed and we started picking up clients, we started listening to the things that they were saying and finding, they needed IT services, so we added those. They needed coding and auditing services, so we added those. We've really been proud of what we've built here, working with the provider community and listening to what kind of needs they have and fulfilling those as they arise. So we
Yeah.
have a very dynamic approach when we deal with a clinic, and it's very collaborative. We try to fit into their practice. We don't force them to fit into our mold. We do try to give them guidance. We have a fairly structured process, but we also try to realize that some clinics have a lot of employees and they have plenty of people to divide tasks out and do things. Some clinics, it's just the doctor and his receptionist or his assistant, and so you have to be able to be able to accommodate those things and
Right.
work with the lack of staff or the amount of work that they have being processed. So we can kind of take those things and work through them and make them more efficient and more productive and help turn their revenue around. Our
Right.
average client sees between a 15 to 25% growth in revenue their first year with us. And a lot of
That's
that is
wonderful.
just through diligence and working things, making sure they're credentialed properly, making sure they're set up properly with all the plans, and then actually working their accounts. So we've been very proud of what we've developed. It's proven very effective. And for most clients, we have seen very long, healthy relationships that have yielded them quite a bit of revenue.
You know, Shirley, it's very intriguing to me because as someone who comes from a non-healthcare background, as far as, you know, from the professional level, when I personally go to a clinic to see the doctor, you know, I'm just thinking about I don't feel well, or either I'm there for preventative, you know, a visit, whatever it might be. But I'm not thinking about what's going on behind the scenes. I'm not thinking about the wheels that have to be turning and the systems and processes that must be in place to assure that my records are secure, my records are correct, and they're tied to my name and my date of birth and those things, and that they are shared if there are any other physicians or clinics that I've authorized to have that medical information, billing, insurance, you know, the list goes on. Certainly, I am on top of those things just as an adult and taking care of me, putting things in place, but as being a patient, and quite honestly, a lot of the providers at the same time, it sounds like what you are providing, it makes all of that seamless as it should be, right? For the provider as well as the patient.
We sure try to. Now, some
Yeah,
clinics, obviously, that works better than others, and you are at the mercy of what the patient provides you. And that's something a lot of patients don't understand. It's very frustrating being that person at the front desk who's trying to get you to pay your copay when you don't really want to pay it. You don't feel well. You just want to be seen. You don't want to
right.
struggle with, gosh, my debit card won't work, or I forgot my checkbook at home, or
Mhm.
whatever. But all those pieces make the clinic function. That
That's
clinic
right.
can't stay afloat if they can't collect your copay, get all your insurance information, get that claim filed, and get their own revenue in the door. By the same token, helping the clinics understand the importance of collecting those things in order and making sure that they're accomplished effectively makes makes or breaks the clinic.
Yeah, yeah.
There are several carriers that have very short filing windows, some as short as 90 days, some as long as a year. So if you happen to have one of the carriers that has a very short filing window and you didn't provide the correct information when you're at the front desk, it might take us 2 of those 3 months to work all that out. So having a billing company that can stay on top of that and make sure that things are filed and they're doing quick follow up and making sure that everything went through the process like it's supposed to is super important.
Yeah, it helps everyone in the process
Absolutely, it means that
involved.
the clinic makes the revenue they're supposed to make. You're paying the amount of money you're supposed to pay. The whole process works. You know, if you're not following through on your end of the process and that clinic can't survive, you've shorted yourself a medical provider.
Exactly. And while those things are always important, particularly now in light of the current pandemic and the enhanced emergence of telehealth and making that available to individuals, gosh, you are certainly playing an even more crucial role. Tell us a little bit about the back end of the telehealth from the CPR perspective.
Well, the first week that this all started happening and clinics started closing and employers started letting people work from home and everything kind of took hold, we started realizing that the way most of our clinics were going to stay afloat was through telehealth. Now, providers who have to have their hands on you, like surgeons, physical therapists, there are very few, if anything, they can do via telehealth. But as much as they can do, it allows the patient to be seen without potentially exposing the clinic or without exposing themselves. They're able to stay home and stay safe. The carriers, that first couple of weeks, it was really rough for them too, because some of them had telehealth procedures in place. Some of them had them, but they weren't very well structured. A lot of changes were being made. God bless the president, because every other day he was on television slightly changing the rules, which then threw everybody into a tailspin. So that first couple of weeks, we were very busy on the phone with all the carriers. We personally validated all the information going out to our providers. Our providers were getting emails from me every couple of days saying, okay, now Cigna is doing this and Aetna is doing this, and you're going to need to file this way, or we need this piece of information. So that kind of communication, I think, was very important to help keep everyone afloat. Now, the people who don't have anyone taking care of their billing, it's been probably exceptionally challenging for them because they have had to change the rules a couple of times. Several of the carriers have had to come out and say, well, that wasn't working, so now we're going to do this. Or we thought we wanted these codes, but now these codes are approved and we're going to add them. So there's been a lot of on the fly figuring out what you needed to change. And then a lot of the relaxing of procedures. So you can do telehealth in lots of ways that it wasn't really designed to be done originally. We still recommend to our clients that they use a HIPAA compliant portal whenever possible. And we have 2 or 3 that we've been recommending. But you also, in absence of those, are able to do things with telehealth that you couldn't do before. We think that that's going to make for a really big change in how healthcare is administered going forward. That's going to provide changes
Yeah.
that never would have existed otherwise. But we also tell our clients to be very, very cautious that you still need to think about your HIPAA privacy rules. All of that still needs to be at the forefront of anything you're doing. Whenever possible, you need to be doing things absolutely the correct way, because there will come a point when this is over and we're going to go back to following the rules a little more tightly, making sure that everything's documented. I do
Right.
expect that there's probably going to be some permanent changes in procedure. But the beautiful thing for the patient is that they can go in most of those tools. They're sitting in a virtual waiting room. They're able to pay their copay electronically while they're sitting there waiting, or at the conclusion of the visit. The provider can keep up with what's going on, and it keeps everybody safe. So patients, even when this is over, patients that normally have to travel long distances just for a follow-up may be able to do those things more readily via
Right.
telehealth.
Yeah, definitely more changes on the horizon for sure. And you and your company are such a crucial part of that. I know we talked about the beginning of the company. You started it in 2010 and kind of where your desire came from. But when we look at it from a perspective of entrepreneurship, you have gotten some awards and kind of making some headway. And I want to recognize you for that, because I think it's very important to recognize that you are minority owned, you're obviously woman owned, veteran owned, and I want that to be a source of encouragement. Tell us about your 2 years in a row, 2 consecutive years. CPR was chosen as a top minority owned business. Congratulations. Tell us a little bit about that.
Well, you don't think much about your heritage when you're starting a business. There are lots of things from my past, like my Army service. I was in the Army Reserves for several years, and my mother was born in Spain, so I'm half Hispanic. So there are lots of things that play, and of course, being a female, which my husband still chuckles at the number of times that we will be in some interaction with someone else, and people do not acknowledge me as the owner because I'm a female.
Wow.
It happened we moved to this new office space and had an open house ceremony, and there was a gentleman who walked in the door, and my husband and I were standing there together, and he assumed my husband was the business owner. And my husband still finds that kind of amazing that in this day and age, that stuff still happens. I guess I'm so used to it. I just plow through and keep moving. But I didn't think about any of that necessarily when I started the company. But as we started moving, and we've been working on trying to maybe do some business in the government space, all of those categories become very important. So
Absolutely.
it prompted us to really start looking at, okay, well, what are we really? Because we're a service organization. That first and foremost is what we want to be known for. But I'm very proud of my military service. I'm very proud of my heritage. All of those things can and should be recognized. So we started putting things in place. We are members of the women-owned business associations. Arkansas has a minority business enterprise for which we're members. So we've tried to kind of look at what's out there and where we can receive that recognition for fitting in those categories where business owners are looking for that in particular. being a minority business enterprise in the state of Arkansas has brought us a couple of clients directly from minorities who want to do business with minorities.
That's
And
fabulous.
I never would have imagined that in the beginning, but
Mhm.
now being in business a while, I appreciate that a little bit more. Like we tend to do business with Arkansas companies anytime we can. It's part of our mission to try to keep
Yeah,
it local, keep it in the family.
right.
So
Absolutely.
all of those things have brought us business in some kind of unusual ways because people are seeking out those kinds of companies.
Yeah. Wow. That's tremendous. And you're doing so much good to help spread the word just by sharing your personal story. You know, one would hope that we had gotten beyond that type of behavior as a society, almost an assumption. And I know there's more stories out there like that. So I'm really encouraged that you're open to sharing yours and that you took those steps to raise your hand, so to speak. You know, say, this is my heritage and I'm proud of it. Not in a boastful, way, but in a way that says, hey, this is worthy of recognition and worthy of sharing. So I applaud you for doing that. And the awards just continue because you also received last year the Governor's Challenge Award. What went into that, Shirley?
Well, we are members of the State Chamber of Commerce, and that's another organization that I think is probably way underrated. We've actually gotten a lot more benefit than I ever would have imagined out of that, particularly during this crisis, because they've been able to navigate a lot of the government process for us. They put information out and help us move all that along. Well, the Governor's Challenge Award is something that is administered through the state chamber. And there are 4 levels of it. And so the Challenge Award is the first level. And we were talking about doing the second level this year, but with everything that's gone on, I think we're probably going to push that another year. Basically, you go through this process to assert that you have met the quality measures to be recognized in your industry. So you have to provide policies and procedures. There's a long evaluation process that you go through where you're providing what your work chart looks like and who answers what questions and what procedures you have in place. And then they come back to you and give you recommendations at the end of that to help strengthen your company and move you to the next award level. So ultimately, the goal is to achieve the top level where very few companies nationally actually reach. And it basically asserts that you have met quality standards, you have policies and procedures in place, you have all the things for your type of business in place that you need to have to be successful.
Wow, another wonderful accolade and a lot of work that went into that. So
It was.
you're definitely not afraid to do what it takes, Shirley.
I don't know how to not work.
Yeah.
I tend to volunteer for a lot of things. Several of my friends say I don't know how to say no, but I find something like that I'm passionate about, and
Right.
I can see the benefit to the business in the long run. And God bless Trish Valines at the chamber, the state chamber, because she just adopted me and kind of loved me through the whole thing and helped me along. And the chamber's really great about that kind of stuff. And to be able to have that kind of award, it was a big award ceremony they had in the fall, and to have that achievement, you're recognized by the governor. It's a very emotionally fulfilling.
Oh, I bet. Yes. Very, very rewarding,
Yes.
especially at the end of all the hard work that it took to get there for that moment and for the award itself. Well, speaking of volunteering and giving, something else that you are passionate about, Shirley, is education.
Yes.
And particularly as it pertains to tools and resources, there seems to be a pattern here that will help execute education more, streamline it more so for parents and teachers. And so, with that said, you have partnered with an organization called Zuni Learning Tree.
Yes.
So, tell us a little bit about Zuni.
So Zuni is an online community of educational resources put together by professionals. They go through and actually procure the information, vet it, make sure that it's strong quality information, and it puts everything in one place so that teachers or families can access that information to enhance their learning experience. I sat here with my own child. All the parents are joking about what their homeschooling experience has been like. And I've been pretty fortunate. I have a junior in high school, so he's relatively self sufficient. But I've gotten to be friends with a lot of the teachers and the support staff at the school. And what I was seeing is, they're doing a fantastic job, but it's also very difficult for them to keep that engaging and move things along and keep it interesting for the kids, especially when they're not sitting right there in the classroom where the teacher can engage with them one-on-one. So Tina is a lady that I had met a couple of years ago through, I did the 10X conductor class out of the conductor in Conway. And she and I had gone through that program at the same time, and I was fascinated by what she had put together. So I was sitting here thinking about ways that we could kind of support the teachers and give them tools that would help make things more interesting, more enhanced, and help her at the same time. And we started talking about ways that we could pool our resources and put those things together, and kind of worked our way into this partnership. So we are currently offering it to the middle school and elementary school at my child's school, which is Maumelle Charter middle and high, elementary, middle, and high school. And we're going to kind of see how that goes. And we're kind of offering to sort of be the test study for that, so that we can provide information that Zuni will be able to then recreate in other atmospheres. For us, it was a very simple decision. Tina made it very, very easy to do. You have put her email up there on the screen. I would encourage companies to reach out to her. It is a very easy, simple marketing opportunity. Your logo goes on all the materials going out, which is not necessarily why we did it, but from a company perspective, it's very easy to appreciate how you're doing something to help the community that also helps you as a business. It's a fantastic marketing opportunity.
Right. Well, and I am grateful to have met you, and you've made me aware of Zuni, and I've actually had a conversation with Tina, and I think that what she has compiled is just a phenomenal resource.
It is.
I'm excited to join you ladies as we work through together how to scale this beyond Maumelle Charter, hopefully throughout Pulaski County, and then eventually across the state and beyond. So you all, I do have Tina's email up there, as well as the ticker with her phone number. Screenshot this, jot down her email, jot down the web address, which there you go, there's the web address again, and check it out. I do know that Tina is anxious for feedback. And so if you are willing to sign up for free and try the platform out for a few days and email her some feedback, I know that she would be most appreciative for that. And as Shirley mentioned, this is a wonderful opportunity to partner to get the exposure as a small business. And so it's a win-win. You're helping the parents, the teachers, the educators have a more streamlined approach to learning, particularly during these homeschooling days, and you're getting the exposure to be tied with something, really worthy as well. So great stuff there. Shirley, before we move toward wrapping up, what else do we want to share? Is there anything else about your business or, the community? Or I did want to pop this up here as your little tagline, because I think it's so great, and I meant to put it up at the beginning of the show, but let us breathe new life into your practice. I know that you already mentioned at the beginning what you do, but what are just some very practical, simple ways that you're breathing life into the practices that are your clients?
Sure. A lot of times we find when we take over billing for a practice, there are several very simple changes that we can make, enhance what they're doing, help them streamline processes, and without giving away all our secrets. We sit down first off and look at their AR reports and see how often their AR has been worked, how thoroughly it's been worked. If there are a lot of denials and rejections, we double check everybody's fee schedule and make sure they're being paid at the appropriate rates. A lot of the carriers update the fee schedules every year. Sometimes the clinics don't really keep up with that. So you may find that the carrier has outpaced you in fee schedules. So maybe 3 years ago they were paying $45 for something, and so you were charging 50. Well, now they're paying $60 for it, and you're still charging 50. So there are opportunities like that where we can close gaps. But a lot of it is in streamlining the actual office procedures, making sure that you are documenting your notes and getting everything closed out at the end of the day, that everything's getting turned into us so we can bill it. We have a couple of, we call them safety net procedures, where we require the providers to give us a little extra information, but it's so we can make sure that if you say you saw 20 people today, we have charges on 20 people. We found in the beginning that a lot of clinics had charges in their systems that had never been billed because they didn't have any way to know that they hadn't been billed.
Yeah.
So that was something that became important very early on for us to figure that out. Now, we've changed software platforms over the years. We have a couple of specialty platforms that we work in, but basically, no matter what system we're in, no matter what process the clinic uses, we still fall back on some pretty standard procedures that help keep a lot of things in line. We offer our clients a HIPAA compliant portal that's free to them so that they can push information over to us. One of the more surprising things to me over the years has been the number of clinics that do not possess any type of secure email. So this gives them an opportunity to get information over to us in a HIPAA compliant fashion where they're not potentially exposing themselves by emailing or texting information that they really shouldn't be sending out. So a lot of that kind of helps support the infrastructure. Most clinics find once they get the hang of that, it makes them more productive internally as well, because they can use a lot of that information to supplement their own in-office procedures. So they're able to do their end of day more effectively. They're able to make sure that the girl at the front desk collected the appropriate amount of money. And so they're able to take the things that we ask them to do and use them for their own purposes to support the practice. As far as other things about me personally, so we talked about my passion for children and education. I'm also a huge animal lover, so we work. We actually just started a relationship last year with the Humane Society of Pulaski County. We haven't gotten very far with that, but we're working on developing that now. And I work closely with Ark and Paws in Conway. I have a friend who's one of the board members with that, and so wherever we can insert ourselves with that makes sense, we try to do that. And then we work closely with, this is going to sound like a complete departure of the norm, but we work closely with Hope Rises in Little Rock, which is an organization who takes women who have been incarcerated and help transition them back to normal, productive life. They do that through classes, education. They help them with job assistance, resume writing, financial literacy, anything that can help them get back on the feet.
You're a little bit of a busy lady, Shirley.
A little bit. I like it that way, though, and
yeah.
we love to travel. You mentioned at the beginning that I like travel and photography. If I could figure out how to combine the two of those and make a good living, I'd probably be doing that. But I love what I do in healthcare. Healthcare is one of those things, unless you set out to be a doctor or a nurse, you just sort of land doing what I do. It's not something that you sat in your high school counselor's office and said, "Oh, can I please go be a biller?" You sort of land here and you find out that you're good at it, and you realize that you're able to impact lives. And we talk about this, our senior staff talks about this all the time. When we look at the clinics that would not exist today had it not been for us being able to help them set themselves up for the future, it's quite gratifying to be able to know that you had that much of a hand in someone's success. And we love it. We love that behind the scenes place that we are, where we're able to make them successful.
Well, and it shows. Your passion comes out and you just talking about it. And I know that you operate with a spirit of excellence. It shows again. So yeah, you're walking in your gifts, my friend, for sure. I want to put your website up there one more time because I want to make sure as we close out that people see that, so that if they wish to get more information, and then they can always reach out to you too about Zuni Learning Tree. So
absolutely.
Shirley, I've enjoyed this as I knew I would.
Thank you
I've
so much.
learned a little bit. Yeah, you're welcome. Really appreciate your time away from those crucial things that you're doing every day to spend a few minutes with me on the show. To everyone who is watching, thank you. Thank you for your support of the Maumelle Chamber and all the area chambers and the larger chambers. Small businesses like us appreciate the involvement that we get to have and the support that you give us. Thank you for followers of Southern Inspirations. Please continue to like, share, and comment. Excuse me. As my heart and my passion is to continue to share good stories about good people doing good things. And, you know, I try to always close with, if you are a leader of a nonprofit or you know someone who plays a vital role in a nonprofit, I want to share as many nonprofit stories as I can. And so, Shirley, I will be following up with you on a couple that you mentioned, of course. It's just about getting the word out and encouraging and inspiring others to chase what's important to them. So with that, we will close this out. Thank you again to everyone. Have a blessed afternoon. Stay safe and stay healthy, and I'll see you again soon. Bye-bye.